Today on Patients at Risk, a heartbroken daughter shares the story of losing her father for the tragic reason of a missed pulmonary embolus by a nurse practitioner. Angie Pereira says if her dad had bypassed the after hours clinic staffed by an NP at his primary care physician's office and instead gone to an emergency room staffed by a physician, he might still be alive today.
My name is Angela Pereira. One Sunday morning, I was in bed asleep and my phone rang. It was my parents' house, which I thought was really odd because it was kind of early. It was my brother. He lived with my parents. His voice on the line was an immediate concern because something was obviously wrong. He told me that dad was on the floor, non responsive in the bathroom. I said, "What do you mean?" And flat out told me that dad was dead. And I'm like, "No, that doesn't make sense." And I started screaming. And my husband, who was downstairs, ran into the room because, well, obviously he didn't know what was going on. And I'm just screaming, "No." We immediately get dressed and jump in the car and start heading that way. And I'm trying to get a hold of my sister. By the time we got to my parents' house, the aunties were there and they were waiting on the judge to come and pronounce him before they could take the body. And so I went into the bathroom and there was my dad on the bathroom floor. I didn't know exactly what in the world was going on. Why this healthy man who walked every day, he took his dogs on a walk every day, would be all of a sudden dead. I knew that they had gone to Dallas Market. When they were at Market, my dad was having some leg pain and a little bit of issues with breathing. He went to work and he couldn't make it up the flight of stairs in the parking garage. He had to sit down and rest. That doesn't make sense. The next morning was a Saturday. He went to his primary care physician's office and saw the nurse practitioner there. My dad presented with classic symptoms of a pulmonary embolism, shortness of breath, pain in the legs, which would have been a DVT. His family history, his grandmother, his mother, and his brother died from DVTs that had become PEs. So his history was there. They had an x-ray machine in their office, but unfortunately was down. So instead of sending him to a hospital, which was not far away at all, I mean, you're talking a matter of a few miles away, after listening to his lungs and telling him that they were clear lung sounds, she said to him that he had pneumonia. You can't have a clear lung sound and pneumonia. Those don't go together. She prescribed him antibiotics, told him, "Go home, and if it gets worse, come back and see me." The next morning, he died. He was 59 years old. 59. I mean, I am currently 51. You don't expect to lose your parents at the age of 59.
I'm sitting here listening to your story and I got a knot in my stomach just for my own memory. I lost my mom when she was 49 very suddenly. And I remember that phone call. I was on call, I was an intern, and I picked up the phone and I could hear my sister wailing in the background and sobbing. It was such a surreal experience in just even to how is this person that's so important in your life suddenly gone? And to think that it could have been prevented had he gotten the correct diagnosis, had that nurse practitioner even sought consultation with her supervising physician. She was actually practicing in a physician's office. But as far as to your knowledge, she didn't get any help or advice.
No. And what people don't understand, you've got all these legislators who scream statistics, statistics. This isn't a statistic. This is a human life. What the legislators aren't realizing is that life right there that was taken from us affected all the lives downstream of it. My mother is now a widow and they had a business. She didn't know how to do a lot of the things in the business that he did. I was working in real estate at the time, and I left a lucrative career to go help my mom with the family business because she needed help. And then my brother, to say that it destroyed his life is very minor because he is a shell of the person that he used to be. Because my dad was the person he looked up to, was his hero, was who he went to for everything, absolutely everything. And it destroyed that. My sister is greatly affected. And so it's a big deal. But the lawmakers, they don't understand that the consequences of these actions, they're beyond just the statistics.
One of the things that you've been doing is sharing your story with those legislators, especially when they're considering expanding scope of practice for nurse practitioners. In this case, the nurse practitioner was technically under a physician, although clearly not as closely as should have been. And that's another element that we need to get into. But they are actually considering allowing nurse practitioners to practice without any physician supervision. And a lot of that is because of a lack of access, especially in rural areas. And one of the things that you wrote in your testimony was, I understand the desire to improve access to care. However, access to inexperienced, untrained care resulted in my father's death. If the after hours clinic had not been open, my parents would have gone to an ER staffed with physicians, and instead, they were treated by a well intentioned but inadequately trained practitioner who didn't know what she didn't know and didn't recognize that she needed to refer my father to a higher level of care. So please ask yourself before you vote, would you want to live in this position? Would you want to place your life, your parents' life, your child's life in the hands of someone with such little medical or practice education, limited training, and significantly lower experience than that of a licensed physician? I can tell you my answer, no, not just no, but hell no. So that is such an important message. It's not just access to anybody, it's access to somebody that has the proper training and experience. Otherwise, you're actually going to be more likely to harm someone than if they had not even seen you at all.
I live in a rural community. So the nurse practitioners want to say, if we can get independent practice, we're going to go out into these rural, underserved areas and we're going to help. We are going to be a force out there of good. Well, here's my thing, and these are my questions for them. You can do that now. You just need a delegating physician. So please explain to me, if you can do it now and you choose not to do it, then why should we believe that you're going to do it if you've got independent practice? That doesn't make sense. It's kind of a bogus thing to say whenever you're sitting here saying, oh, well, I could do it now. I'm not. But if you give me independent practice, if you give me something that I want, if you give me the power and the control that I want, then I'll do it. But the problem is I'm telling you right now, they're not coming. They are not going to come because if they won't come now, they're not coming later. So I do not believe them at all.
In your testimony, you make the argument that, listen, you're from a rural area, you understand the need of care, but you're saying, like, hey, just because I'm in a rural area, why should I get lower quality care or a lower standard of care? Don't I deserve, as a rural citizen of Texas, of the United States, the same access to a qualified physician as someone who lives in an urban or suburban area? I think that's a really important point.
Correct. If we live in the sticks, does that mean that we are lesser? I would like that clarification from legislators. Are we lesser? Are we not as important? Because I'm going to tell you right now, when I go in the voting booth, my vote actually counts as much as the vote of a city vote. I'm just going to say it like that. So it's not right to make an assumption that we out here don't deserve doctors. There have been bills introduced to make pathways for residencies to have other doctors from other countries who are very qualified They have been through medical school. They've done training. They probably have years of experience. And there are bills introduced to create pathways for them to come over and to be able to treat if they're moving here. There are programs that can be done to offer incentives for doctors to come out here.
Yeah, there are other ways instead of looking at this shortcut. Well, let's just put a person that has 500 clinical hours of experience and let them do this type of work because they make all these promises that really are not being fulfilled. But instead, we need to take the time to really create good long term policy that makes sure that everyone has access to a qualified physician.
With the nurse practitioners wanting to purchase independently, they try to say that they want to provide the same quality of care that a physician will. But here's the deal, if your goal is to serve patients and serve them to the best of the ability, why would you want to take a shortchanged path? There's already a path to becoming a physician and having the highest level of training and the highest level of education. There's already a path. We all know what it is. You go to medical school and you do a residency and get all of your training in, and you're going to pick your specialties and everything. That's the path. Why do you want to shortchange the path, which then shortchanges the patient? I mean, if you truly believe that you want to provide care, and that's an important word, care, you want to provide care and you want to make sure that the patients are taken care of wherever it may be. Why would you shortchange them by shortchanging your education, your training, and your knowledge? Why would you shortchange the patients? I would like that answer. Why do you think that it's okay?
I think it's very important. And what I hear from many NPs and PAs who have reached out to me, those that are more experienced, those that have more insight, they say they don't want independent practice. They want close communication and oversight and a relationship with a physician. But their leadership, their advocacy arm, their lobbying arm are the ones that are really pushing this agenda. And in fact, there's been a call from nurse researchers and practicing nurses to say, we want more education, we want more experience and training, but that is not the messaging that the leadership and the lobbyists are giving. So there's a big contradiction there. And I think it's something that NPs in general need to wrestle with and make sure that they're holding themselves accountable, because if they're not, then someone else is going to have to. Of course, up to this point, it hasn't been the legislators. And one of the things that I really appreciated that you wrote in your testimony is that our legislators need to be accountable for their decisions. And you wrote, you are placing our lives in your hands because you must realize that should independent practice pass, insurance companies will gladly begin mandating who we can and cannot see under circumstances they decide of appropriate based on protecting their bottom line and their shareholders. And I think that's a really important messaging. And it's until constituents get angry and frustrated and unfortunately, I hate that it has to be because someone gets hurt and dies, that we start making our voices heard to our legislators to say this is not acceptable.
That is very true. So the thing is, right now, patients are being actually pushed toward a mid level as a PCP, which let's define PCP. That is your primary care physician. And that last P is the most important thing to me. But more and more patients are being pushed towards mid-level, your MPs, your PAs, et cetera. You're seeing it a lot in corporate. I'll just flat out state it as it is. Corporate healthcare is a beast. It is a beast that needs to be managed. It needs to be brought under control, because I've been in situations where we're dealing with some bait and switch. I can tell you that I've had it happen 3 times with my family. The first time was with my daughter, and that was in neurosurgery. Unfortunately, her fabulous neurosurgeon retired. I really hate it when you guys retire because it really puts us in a bind. But she retired, and it was a corporate deal there that had taken over. We were scheduled to see a new neurosurgeon, and we showed up, and were told we were seeing the nurse practitioner. And I was like, no, that is not who I made the appointment with. I made it with the physician. And they're like, oh, well, he's not here. Excuse me? Wait a minute. And so we ended up seeing that nurse practitioner. She and I got into a little argument because I know my daughter's history, and I told her that we needed to have a specific imaging done. My daughter's a heart patient. She has a pacemaker. This nurse practitioner wanted to put my daughter in an MRI. You don't do that with a pacemaker. She needed a CT myelogram. We were trying to make sure the cord wasn't retethering because she was having some issues with her legs. And so she and I got into an argument, and I told her to contact the physician. And after much going back and forth, she finally did contact him. And he said that I was correct. And I was just like, how do I have to battle you? I mean, the only reason I have the knowledge I have is because I've been going through this for so many years. It was absolutely ridiculous. And had I been a parent without that kind of knowledge, we would have shown up for an MRI. And I have hope that the people there, whenever you fill out the paperwork and you say, yeah, she has a pacemaker, they would have been like, no. And we would have been sent on our way. But had there been fall through the cracks, God knows what could have happened.
And would
That,
the time, money, energy, best case scenario, it's all of that.
oh yeah, when we went and we saw the nurse practitioner, guess what? We paid the exact same copay that we're paying for the doctor. When you get your EOB statements in, guess what happens? Most of the time, it's billed that you saw the doctor. That's what your EOBs say. And so for anybody that doesn't know what the EOBs are, those are your explanation of benefits that you get in from your insurance company after an appointment. Most people talk them, they don't know. Look at them, because you're going to find out that they will charge as if you saw the physician. So why are you paying a physician rate for the physician's training, the physician's education, when you're getting lesser than? That doesn't make sense. You're paying for a premium, but you're getting regular. Our second issue was my husband, who had a heart attack in January. I'm very protective of my family. I made the appointment. His PCP retired and left and was replaced in that office by a nurse practitioner. I said no. He said no. We were having issues with a nurse practitioner. I called, made an appointment, very specific about it being the physician, because we were establishing care. In a PCP situation, that's very, very important with your insurance company, because if you see the nurse practitioner, you have now established care with the nurse practitioner under our insurance. And therefore, that nurse practitioner is now your primary care. And so I was very specific that it was with the physician. We showed up and they told us that he was seeing the nurse practitioner. I jumped out of the seat in the waiting room and said, excuse me, no, we are not doing the bait and switch. This is wrong. And they're like, well, the appointment's with the nurse practitioner. I said, big mistake, because I made the appointment. I made the call. I know what was said. I know what I did, and I know what my intentions were. And unfortunately, we ended up having to see the nurse practitioner with the understanding that the established care was going to be with the physician. My husband hasn't been back, so we don't know yet what's happening there. So we're in limbo on that one. My third situation was just last week. I made an appointment with a neurosurgeon. They called me and told me the day before, you're seeing the nurse practitioner. I said, no, I'm not. I am seeing the physician. I know the complications that are in my spine. I need to see the physician because my history needs to be discussed with him. They then proceeded to tell me, oh, well, you can't see them until you see the nurse practitioner and they do ordering of tests and stuff like that. And I'm just like, I need my history with the physician and discuss that with them, and then reorder tests so that we can make sure that we're doing what we need to do. So they said, well, you can't see him unless you've had imaging. This is big corporate. This is actually a big corporation here in Texas. I said, fine, why don't you just order the imaging and I'll go get it done, and then we'll meet afterwards. They said, no, you have to come in and see the nurse practitioner. And I was like, are you kidding me? I don't want to come pay my $40 copay for a physician to see a nurse practitioner that I'm not going to have actual care from. I'm wasting my time. I don't want to have to go through it with her and then go through it with the physician. I don't want to pay the money to see her and then end up still paying the money to see the physician. And so it was a bit of a battle. And then finally they said, well, then you can have your primary care physician order it. Okay. So my primary care physician had to blindly order the test. And we had a conversation back and forth regarding MRI versus CT because I have a cage in my spine. That metal can cause some issues, especially in the MRIs. So we ended up doing a CT. I had my appointment rescheduled. Then I got a call a couple of days before my appointment. And they said, we have to cancel, reschedule. On that call, once again, demanded the physician. Very, very specific and very, very firm. And so we had all of it scheduled. Then it comes to the day before my appointment. Again, I'm online, I'm doing my check in, and I notice that it says my appointment's with the nurse practitioner. So this had switched within maybe 36 to 48 hours. So I called them and I said, excuse me, I am not seeing the nurse practitioner. I'm seeing the doctor. I know for a fact it said that a couple of days ago. So I'd like to know what is going on. They said, no, you have to see the nurse practitioner and you need to see pain management before you can see him. And I'm just like, what is going on? They kept using this word protocol. So I told them, then cancel all the appointments. I don't want anything. Like, if this is the way that this business is going to be run, then I don't want to do this. I will find somebody else. So I did also inform them that I would be reporting them because patients need to advocate for themselves, not just in the doctor's office, but you need to advocate for yourself. When something is being done and it's being done wrong, patients need to advocate.
It's an unbelievable story, but it's all too believable because it's happening so much. And I think as hard as it is to be that squeaky wheel and to push back and to vote with your feet and try to find somewhere else to go, that's the only thing that I believe is going to force change when people just say, absolutely not, I'm not accepting this, and also reporting it. And hopefully there will be some political will, whether it's the Board of Medicine, whether it's an attorney general somewhere, a legislator, somebody that says, this is not good for patients, this is not good quality care, and this is not okay.
The thing is you've got corporations, you've got business people making medical decisions essentially. So imagine if your mid levels end up getting independent care abilities. Do you think that corporations are going to keep physicians or are they going to basically throw out their stock, restock with the lower paid mid levels? That's what they're going to do.
Now, Angie, you are doing so much to get the word out, testifying and talking, coming on this podcast. And one of the things that you did that I thought was so important was you created a social media page. Talk about that and what the idea behind that is.
So I have a page that's a support for those that were injured. The reason that I did it is because when I go in and I testify, I'm going to tell you, I am almost always the only citizen in there. I'm not part of a special interest group. I'm not a lobbyist. I am the only citizen in there. And I want other citizens to wake up. They need to go and they need to sit in those committee hearings and they need to testify. Make sure your legislators know how these things are affecting you. If you're going to sit there and just deal with it silently, we're never going to fix the situation. Legislators look at lobbyists and they look at special interest groups because that's all they see. They see it all day, every day. And so they're just like, that's another one. And even y'all go in there and you testify from your own perspectives. But once again, they're looking at you as special interest because they think you're just trying to save your job. No, you're trying to save patients. You're trying to save the healthcare system from the failures that can come. When citizens speak, we're voting. And if you don't listen to us, then we know that you shouldn't be representing us, because the most important thing any representative or senator can do is listen to their constituents. So if they don't want to listen to us, then we will take that into consideration as we walk into our voting booth. And we will look for someone who will listen to us. Because guess what? This is a government of the people, by the people, and for the people. It is not of the corporation, by the corporation, or the special interest groups, or the lobbyists. It is the people. So start listening to the people. And I need more people, please.
And you need more people. And so that's one of the reasons that you created the social media site, to raise awareness, to find people that have stories and help them be able to tell them. But you've had a little pushback. Is that true?
Oh, yeah. From nurse practitioners groups, there's been a lot. One of my testimonies, my sister actually put out on the web, and holy cow, the negativity, the hatred, the vile things that they said to us. One even said, well, maybe your dad deserved to die. How do you say that my dad deserved to die because one of your colleagues made a mistake? I'm sorry. The mentality of what we've seen has been so just absolutely disgusting. When they find my page, I get some of the most horrible messages. And, they tell me how wrong I am. There's usually not nice words. I get called a lot of names. And it's all because I share our story and voice my opinion. And they want to shut me down and shut me up.
Thank you for surviving those attacks. It really speaks volumes about the type of people that are pushing this agenda, that vitriol and that anger over just simply sharing information. And in your case, sharing a really tragic and sad story.
Yeah. And the sad part is that I've gotten literal threats. And I've been told by some folks that I needed to be very, very careful. It's ridiculous that we're in a situation where uh, care providers can be so hateful. So I don't know where they lost that care component, but they definitely have if you are in opposition to them. There is no care.
Wow. Well, I so appreciate and value your bravery in speaking out. And my warning to physicians that are listening, a lot of our audience are physicians. If you're gonna supervise, you better be doing it right. You need to be monitoring what's happening. Ideally, in my mind, you should be on site. You should have very strict policies and protocols for your nurse practitioner or your PA, and certain emergency protocols, things like chest pain, shortness of breath, fainting. Those are not things that they should be managing on their own. And so be warned that the legal ramifications are ultimately, I think, are going to fall to you most of the time.
Physicians have to take into consideration they need to train these people. So when you have XYZ and these are potentially very dangerous situations, those are not a nurse practitioner and not a PA situation. Those are physician, and that needs to be something that they run out immediately, get the physician, let the physician know, hey, this is our situation. Because in my dad's situation, had she gone and gotten the physician, had she contacted and spoken to him, he would have asked for certain things. The information would have been given. But at that moment, when she chose not to consult, she made it an independent care. And she decided that she was the doctor of the day. And that did not go well for her or us.
Well, that's what they often say when they're testifying. I heard a lot of that when I was out in Texas. They say, well, we know when to seek a higher level of care, and we know when we need to get a physician involved. And this is just one example of the fact that no, you didn't know because you didn't go in and seek advice and get extra help, and somebody died because of it.
So here's my question though. Currently in Texas, they actually have to have a supervisory physician that they can contact. So, what happens in the event that independent care were to pass and they no longer have a specific delegating physician that they can go to for help and advice? So, what then happens? Who do they go to if they don't have a specific person? So, then what?
That's my question too, because I heard that testimony over and over again, reassuring legislators, don't worry, because we know when we need to seek a physician. Well, like you said, how are you going to find that physician? Do you have a relationship with somebody if you don't have some type of an agreement? And also, how is that even fair to a physician? Are you saying basically you're going to dump your patients on some random doctor because you don't know what else to do? And meanwhile, you may have done all sorts of inappropriate treatments and now you're basically giving like a bomb into the lap of a physician that now has to deal with all the things that you may have mismanaged and also the potential legal ramifications of that.
I am imploring all the legislators to seriously take into consideration what their votes on our behalf means to us as patients, what one day it could mean to one of them, one of their family members. They need to really take into consideration the actual consequences of what could be if they vote to allow for certain things like independent practice or mid-level.
Thanks so much for listening. I hope you enjoyed this episode. If you'd like to learn more, then I encourage you to get the books Patients at Risk and Imposter Doctors. They're available on Amazon and at barnesandnoble.com. If you're a physician and you'd like to learn more about getting involved in our mission, which is advocating for physician led care and ensuring truth and transparency among healthcare practitioners, then please consider joining our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org. If you're a patient and you would like to share your story, you can do that at our website, physiciansforpatientprotection.org, and just click on Share Your Story. Or you can send me a message through the website, patientsAtRisk.com, and I would love to talk with you and share your story on this podcast. You can also learn on our website what to do if you've had an issue with a nurse practitioner or physician assistant or been deprived of physician led care. There are steps that you can take to report those facilities and help improve our healthcare system. Thanks so much, and we'll see you on the next podcast.